Hi everyone, this is Neel Raithatha, consultant audiologist and director of earwax. Thank you for joining me in my latest video using the iClearScope endoscope. And here we have a patient who attended with a dead skin plug in their left ear. And you can see the colour of this dead skin, it's almost bleached. Now I did ask the patient whether they used any hydrogen peroxide based drops, which the hydrogen peroxide can kill chromopores, and chromopores are the cells in your skin, like melanin, that provide colour. But the patient advised that they haven't used any drops whatsoever, so this would appear therefore to be just their normal skin that's probably shedded quite quickly to be this colour. Just like earwax, the longer skin remains in the ear, it oxidizes and it matures, and it goes from a light yellow colour like this to almost a dark brown and even possibly black appearance. So the fact that they've got this plug that's so light in colour, even at the core, would suggest that this build-up has happened very quickly. And there's some potential causes. Sometimes if a patient has inflammation of the ear canal, which this patient doesn't appear to have, the ear secretes more skin, and the more skin your ear produces, the more dead skin that occurs as a result. Or they may have an underlying fungal infection. So we've got normal resident bacteria and fungi that typically live harmlessly in the ear. But if there's an overgrowth of the fungus in particular, then it elicits an immune reaction, and as part of that immune reaction, there's increased blood flow to the ear, and therefore your ear can produce more skin. So all of our ears is lined with skin, and so is the outermost layer of the eardrum. And typically what happens is, as this skin dies and sheds, it moves sideways like a conveyor belt towards the entrance of the ear. So the ear is self-cleansing in that respect. But as you can see, this skin has failed to migrate. It's formed into a plug, and in the distance, the eardrum is beginning to become visible, but the skin is extremely adherent, and you will be able to see better in a moment. But deep in the ear canal, they've got a very twisty ear canal and a very narrow ear canal. So the ear canal, as we approach the eardrum, it narrows, which is normally the case, but then there's a sharp bend to the left. It's almost like a chicane. There's a lot of dead skin in there, and possibly that prominent anterior recess may prevent the skin from fully migrating out of the ear, because it's quite a sharp bend there, as you can see, just to the left, and sometimes skin can find it difficult to migrate around that. So I'm just holding the suction in place. You can see it's very reflective. That's the keratin within the skin. So the plug itself has now been removed, but we've got this thick layer of skin that's still adhered to the eardrum, and I'm just got to be careful of the ear canal to the left. You can see there's not much space to work with, so it's going to be a bit of a challenge getting into that anterior recess. And this is where I attach the fine end, and I slightly curl it, bend it at the end, and it's not always visible on camera, but it just allows me to enter the ear and avoid, I don't know if you can see that, it's not a significant bend, but it's just enough so I can curl around that front anterior canal wall. Now I'm going to remove the majority of the skin. There's going to be a little bit left near the umbo. Typically you find that skin at the centre of the eardrum, that's the progenitor site. That's where all the skin that lines the inner 2/3 of the ear canal originally forms, at the centre of the eardrum. And that skin then migrates radially to begin with, so across the eardrum to the edges, and then slowly from the deepest region of the ear canal to the entrance. And skin at the centre of the umbo generally becomes the thickest skin, and it's the most adherent. So you can see that there's a little bit just here, and because it's quite a narrow ear, it's difficult for me to manipulate this, to peel it. I can't peel it. Ideally this skin needs to go right to left, because that's the natural way it wants to be peeled, but there's hardly any space for me to move this right to left. So if I move it, and if I move the suction any more to the left, I'm going to bump into the bony part of the ear canal, so I'm going to be very careful. So it's a little bit left, and I'm just going to go back to the floor of the ear canal a moment and peel some more dead skin. And see we're restricted there. But the eardrum is fully visible. It's a bit dull in appearance, but the hammer bone's visible and it's intact. So we're just going to peel this thick layer of skin from the floor of the ear canal. We're seeing a lot more skin peels recently. I've got a couple more to upload actually over the next few days. So do stay tuned if you enjoy a good skin peel. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.